on a radiological investigations, if there will be some changes, if there will be any insult of brain parenchyma, and disease will be called as organic disease, organic mental disorder. No changes, organic mental disorder. Very easy to understand. I have a patient of Alzheimer's disease. I hope you have heard about Alzheimer's right now. And I hope you know the basic pathology in the Alzheimer's disease, that when you do CT scan, you can see what? Cerebral atrophy. Cerebral atrophy. You can see some changes or not. So Alzheimer will be considered as organic or non-organic? Organic. Very easy to understand. Now you make a small table and write the difference between organic mental disorder and non-organic mental disorder. Organic mental disorder, non-organic mental disorder. First of all, always remember that organic mental disorder, on a radiological investigation, some changes will be there. On a radiological investigation, some changes will be there. First point, first difference is what? Some changes will be there. Non-organic, no changes. First point, easy to understand. Second point, organic mental disorder occurs in elderly people. In elderly people, aged people, the old age disease, Alzheimer's, Parkinson's, delirium, dementia, all these are what? Organic only in old age, elderly people. Non-organic, youngsters. Young age. On the basis of this table, there was a question this time. I will show you the question afterwards. Don't worry. Okay? Okay, fine. After that, please write down altered sensorium. Altered sensorium means what? What is the meaning of altered sensorium? First of all, please write down 4 synonyms here. Altered sensorium means senses got altered. Second point, disorientation to time, place and person. What is the meaning of disorientation to time, place and person? क्या मतलब होता है इसका? Means after head injury, if the patient is in front of you and you are wearing this white coat, patient is asking, hey, are you Sanjeev Kapoor? Chef हो क्या? Hey, which type of shopping mall is this? No lighting? Hey, is it day or night? Basically क्या है? Disorientation to time, place and person. आसान भाषा में mental confusion. Altered sensorium, disorientation to time, place and person, or mental confusion. I will keep on like speaking about these words. Okay? Fourth word लिख लो, इसी का synonym, clouding of consciousness. I'm not saying 100% loss of consciousness. I'm saying what? Clouding of consciousness. Okay? Clouding of consciousness. So remember here, altered sensorium, clouding of consciousness, disorientation to time, place and person, and mental confusion. All these are same thing. Mental confusion, disorientation to time, place and person, clouding of consciousness, and altered sensorium. These are same thing. These are same thing. These are same thing. So please write down, in organic mental disorder, altered sensorium, it can be yes and no also. Please write down. So yes, there can be clouding of consciousness. Obviously in the delirium, there will be clouding of consciousness or not, right now? Okay, fine. Non-organic mental disorder, patient will be well-oriented. Well-oriented. Patient will be well-oriented. So we have given first point, second point, third point. Fourth point, please mention. Fourth point. Fourth point, see, hallucination can be seen in both. So remember, organic mental disorder, most common type of hallucination is visual. But in non-organic, it is what? Auditory. Very good. Short tables you have to keep on writing. Okay? Because so this time in MCI, one question from here on the past. दिख रहा है handwriting समझ में आ रही है ना? इससे खूबसूरत मैं नहीं लिख सकता हूँ. ये maximum मेरा capacity handwriting है. Okay, fine. So easy to understand. So now you can differentiate organic and non-organic mental disorder. Very easy to understand. So when I talk about Alzheimer's disease, when I talk about Parkinson's, these will be organic. But when I talk about schizophrenia, schizophrenia, right? When I talk about schizophrenia, right? So schizophrenia patient will be well oriented, but he is having multiple hallucinations. Fine. So that will be what? Non-organic mental disorder. Fine. So remember here, non-organic mental disorder is further divided into psychosis and neurosis. Psychosis and neurosis. Now, how to differentiate psychosis and neurosis? Remember here, non-organic mental disorder is also called as functional disorder. Functional. ठीक है? देखो समझते हैं how to differentiate psychosis and neurosis. I have a patient A and patient B. Patient A is actually, he was my friend only, ortho PG first year. He was suffering from OCD of contamination. What is the meaning of OCD? Obsessive and compulsive disorder. OCD of contamination means what? OCD of contamination means what? Basically, patient is having this kind of uncontrolled thoughts that your hands are dirty, wash it. Here, patient knows that these thoughts are weird and irrational. He wants to control it also, but he cannot. Right now, OCD of contamination. When I will teach you psychiatry, most of you will feel that you are suffering from 1 or 2 or 3. पक्का होगा ठीक है पर्सनल कंसल्टेशन आपको क्लास है पक्का easy to understand that? So see here, so my friend who was suffering from OCD of contamination, he was ortho PG, day 1 in operation theater, day 1 in operation theater, ठीक है? तो day 1 तो यार most important होता है लाइफ का PG में, है ना? वो भी operation theater का. So there was a case of radial bone fracture. His seniors asked him, "Beta, we are going to start the procedure. You go and wash yourself and come and join us in between." So being a surgeon, for how many times you are going to wash your hands? At least up to 3 times. And at least up to 3 times. Maximum for how many minutes? Maximum देखो max की जाओगे तो 5 minutes है ना 2 मिनट 3 मिनट बहुत हो गया maximum 5 minutes max. He started washing his hands. He finished after 45 minutes. He finished after 45 minutes. Now you tell me when he will get back to operation theater. How serious will welcome him? अरे सर आपके ऐसा लगता है सीनियर ऐसे वेलकम करेंगे तुम्हारा 45 मिनट्स में रेडियल बोन फ्रैक्चर सर्जरी ओवर 45 मिनट्स के बाद आए सीनियर्स विल बैंग यू है ना ये दिल्ली का केस बता रहा हूँ आरएमएल हॉस्पिटल का बता रहा हूँ ठीक है दिल्ली में सीनियर्स में हिंदी में अच्छे से तैयार थे हिंदी में अच्छे मैं बोलूँगा नहीं समझ जाओ तो बेसिकली नॉर्मल क्या होता है ना कि सीनियर्स लोग वहां पे देखो आफ्टर 45 मिनट्स ही ज्वाइन सिंपल सारे नॉर्मल है ये एक्चुअली नाम है आपका यानी seniors will abuse you, seniors will scold you, seniors will bang you, but okay, no problem at all. You should get habitual. Okay, sir, sorry sir, thank you sir, fine sir, no problem. ऐसे ही सीनियर हॉस्पिटल में सीनियर से मुंह मत लगाना कभी है ना वो कहते हैं कुछ लोग ऐसा मजाक नहीं करना चाहिए है ना एक तो होता है बाप सर्दी इलेक्ट्रिसिटी दूसरा सीनियर मतलब बेसिकली देखो होता है क्या ना ये स्टार्टिंग में क्या हो गया स्टार्टिंग में आपको बुरा लगे सीनियर आपको गाली दिया सीनियर से कभी मजाक नहीं करना सीनियर जो आपसे 1-2 साल सीनियर वही सिखाएगा आपको जो आपका एचओडी नहीं सी उसके पास टाइम एचओडी के पास जो सीनियर बुड्ढे फैकल्टी से वो नहीं सिखाएंगे आपको आपसे 1-2 साल सीनियर भाई अपना काम आपसे कर रहा है उसी से सीखोगे आप ठीक है ना ओके फाइन सो नाउ यू टेल मी इन फ्रंट ऑफ एवरीवन ही गॉट scolded on day 1 in operation theater see here in the case of OCD of contamination of patient that knows that these thoughts are weird these thoughts are irrational senseless thought but he cannot control he's getting this kind of thought that your hands are dirty wash it he knows that no he wants to control but he cannot control OCD is uncontrolled thoughts ठीक है ना so when he wants to control he is having anxiety simply to reduce the anxiety he has to wash it again and again easy to understand now you tell me when he will be scolded by the senior in day 1 okay on day 1 in operation theater do you think he can go into depression also yes and obviously he can go into depression because on day 1 he got scolded he got humiliated by the senior now you tell me awareness about the disease is present or not and उसको पता है these thoughts are real awareness about disease is present awareness about disease is called as insight so insight means what awareness about disease easy to understand awareness about disease is called as insight. Insight is present. Okay, fine. So OCD of contamination, you can understand, fine. I have one more patient, patient number B. Patient number B who is suffering from delusion of grandiosity. What is the meaning of delusion of grandiosity? Yeah. Police Bhagwan, something like that. After watching movie Bahubali, patient comes out. After that, he said, "I'm the Bahubali." He's saying like, "I'm the Bahubali." After that, someone, "Hey, you are just a cop. Shut up! This is my Maheshwari." Do you think he is aware about his disease? Insight is absent. Right? Insight is absent. Remember, insight is absent. It is called a psychosis. Insight is present. It is called a neurosis. That's it. Easy to understand? है ना? याद रहेगा? Insight is absent, it is called as psychosis. Insight is present, it is called as neurosis. So if I ask you, OCD of contamination will be called as psychotic disease or neurotic disease? Neurotic disease. But when I talk about, say, schizophrenia, then schizophrenia means maximum level of power. Maximum level. So schizophrenia में patient will be thinking that you are patient, he is not. ऐसे होता है, ठीक है ना? Okay, bye. अब ये बताओ ना, when I talk about judgment power, my friend who is suffering from OCD of contamination, now he is going to use a public toilet. He can see that 5 people are already there in their mind. He is thinking that if I am going to start, washing, after that there will be the biggest line in the history. Yeah? Let them wash first, after that I will wash. So judgment power is normal or abnormal? Normal. Judgment power is normal, right? Do you think he knows the reality? He is intact with the reality? Yes. Reality testing, judgment power, everything is normal. But what about delusion of grandiosity? Judgment power, reality testing, everything will be destroyed. There are 2 psychotic disorders. One is called as delusion, another is hallucination. Delusion is the disorder of thought. Please write down. Delusion is a disorder of thought. I am the most powerful person on the earth. I am the richest. Someone wants to kill me. Basically, this is all about the thought process of the patient, right now. And hallucination is a disorder of perception. Hallucination is a disorder of perception. How do you perceive anything? How do you see anything? Fine. So remember here, delusion and hallucination, these 2 are called as psychotic symptoms. So these we are going to see in a psychotic disorder, neurotic disorder. Obviously, in psychotic disorder, very easy to understand. Now, without seeing the notes, please answer. Awareness about disease is called as? Insight will be present in? Judgment power will be normal in? Reality testing will be normal in? If I am doing CT scan, I can see some changes in brain parenchyma. Organic or non-organic? Organic. Alzheimer will be considered as? Organic. Non-organic is also called as? Functional. Non-organic is divided into 2 diseases. Which one? Psychosis and ऐसे रिवाइज करना हो गया, सबको ये भी याद करना, ठीक है सर? चलो next. About the psychiatrist and psychologist. There was a question in MCI in 2018. Which of the following cannot be performed by a psychologist? See, remember here, psychiatrist can become only after MBBS. But psychologist after BA, CA, DA, diploma, whatever you want, you can do. Okay, so see here, psychiatrist obviously. So these are the medical doctors. They can write medications. They can write blood investigations, radiological investigation. But psychologists, they cannot write medicine. They cannot write any blood investigation. ये सब जानने के बाद क्या लगा? Psychologist बकवास है. कुछ काम है इसका या नहीं? Psychologists, they do only talk therapy, only psychotherapy से बातें करना आता है. ठीक है? अब क्या लगता है? Use है या useless है? Use है? चलो ठीक है, समझते हैं. Suppose after scoring 135 in MCI, if a patient is only sad for last 5 days, only sadness is there, you are going to send him to psychiatrist or psychologist. He needs only motivation. But after scoring 149, medico is having extreme level of sadness, negative thoughts, feeling of hopelessness, worthlessness, right? No? Hopelessness, helplessness, worthlessness, I'm just a burden on the earth. Negative thoughts. For more than 14 days. How come it? Now he needs medicine also. Now he needs medicine also. Easy to understand. So psychiatrist means they can write medicine, they can write blood investigation, and so they can do psychotherapy plus pharmacotherapy. But psychologists only psychotherapy, right? Only psychotherapy. So always remember that psychology, they played a very big role during the pandemic. So many people had depression, lack of motivation and all. So they used to organize what? Seminars, workshops and all. Easy to understand? So many medicals will come to our Arise office there. वो जो medical preparation के time में ना आप लोग तो बड़े तुम लोग चमके देख रहे हो सबके सब मस्त देख रहे हो लेकिन during preparation सबकी बत्ती गुल रही है वहाँ पे Indian most of the students will be having this kind of situation. So many medicals they will come to our office and if they want to meet me, they will ask, I want to meet psycho teacher. And this is my introduction. चलो अब ये बताओ, how will you understand? See, what is the pathophysiology of any psychiatric? What is the root cause of any psychiatric? See, if there will be bone fracture, for sure you are going to send him to orthopedician. If there will be acute abdominal pain, you can send him to surgery department or medicine department. How would you understand that patient needs psychiatric consultation? How? So basically, what is the root cause? What is the pathophysiology behind any psychiatric? And basically, क्या कहते हैं इसको? Neurotransmitter. I hope all of you have heard about the neurotransmitter. मुन्ना भाई देखा था part 2. अरे गांधी जी से बात करते संजय दत्त, right? आखिर में पता चला भाई बोलते थे दिमाग में केमिकल का नशा है. वो केमिकल क्या है? So how many neurotransmitters you know? Can you tell me? Dopamine, acetylcholine, serotonin. Always remember that increased level of serotonin, norepinephrine and dopamine in the limbic system, right? The limbic system will cause what? Psychosis. And decrease will cause what? Depression, right? Depression. Increased level of serotonin. See, everything you don't worry about what I have been. Okay, fine. See, remember, yes. So when I talk about increased level of serotonin, norepinephrine, and dopamine, this will cause psychosis, and decrease will cause depression. So basically, now let's understand all the neurotransmitter one by one. After abusing bhang, ganja, hashish, cocaine, whatever you want, okay? Fine, no? After that, you are getting kick, no? After abusing bhang, kick. Oh, why? Please write down. Dopamine is a neurotransmitter for kick. बस इतना ही लिखो काफी है. Dopamine is a neurotransmitter for kick. And so because of dopamine only you are getting the kick, no? Okay, fine. Please write some more points related to dopamine. Dopamine is responsible for kick, reward, pleasure, and addiction. Dopamine is responsible for kick. Okay. After that, reward, pleasure, and addiction. Substance addiction होता है ना? Right? So dopamine is responsible for kick, reward, pleasure, and addiction. Serotonin, please write down. Serotonin is responsible for good food, good mood, and good sleep. Good food, basically I can say serotonin is called as what? Happy hormone. Please write down. Serotonin is called as happy hormone. Happy hormone. Serotonin is responsible for good food, good mood, and good sleep. See, now you tell me. Suppose if I have a patient who is 19-year-old female. 19-year-old female, after breakup, she is not sleeping, she is not eating, and she is not laughing. So basically, lack of food, lack of mood, lack of sleep होता है. आपके एज में कुछ ज़्यादा होता है. तो कितनी बार हो चुका होगा? बहुत बताएं whatever समझ में आ गया ना? So now basically my patient is suffering from what? Lack of food, lack of sleep, lack of mood. Basically she is suffering from depression. Basically diagnosis क्या? Depression only, no? So do you think if I can increase the level of serotonin, I can improve her mood, food and sleep? Easy to understand? So basically if a patient is suffering from depression, do you think he or she is having deficiency of serotonin? Yes. Deficiency of serotonin means what? Patient is having what? Lack of mood, lack of food, lack of sleep. So now that's why I have to increase the level of serotonin. So I have to give which medicine? SSRI का नाम तो सुना होगा. Full form क्या होता है? Selective serotonin reuptake inhibitor. See, whenever I am giving a reuptake inhibitor, after that level of neurotransmitter will be increasing or decreasing? रीअपटेक इनहिबिटर का मतलब क्या होगा? ये रीअपटेक को ब्लॉक करेगा ना, तो सिनेप्टिक क्लब पे क्या होगा? इंक्रीज करेगा, राइट? इट विल बी increase. So always remember that whenever we are going to use any reuptake inhibitor, amount will be increasing. When I am saying antagonist, amount will be decreasing. Easy to understand? So when I give SSRI, obviously level of serotonin will be increasing. That's why these days drug of choice for depression is SSRI. Drug of choice for depression is what? SSRI. SSRI का कोई एग्जांपल तो दो. फ्लोक्सेटिन, एसिटाइलोप्राम, ये सब बड़े फेमस ड्रग है. फ्लोक्सेटिन, मैंने याद रखो. कुछ मेडिसिन के नाम हमेशा टिप ऑफ द टंग पे आते हैं जो फार्मा में पढ़ाई किया. फाइन. और चलो समझ में आ गया? ओके फाइन. नेक्स्ट. नाउ during the break, after 2 hours of class, we will be devastated, exhausted. And after smoking a cigarette, now again full of attention, full of concentration, full of judgment power. How? So biggest thing here, biggest understanding is that after smoking cigarette, cigarette क्या होगा? Nicotine होगा ना? Nicotine stimulate dopamine as well as acetylcholine. Nicotine will increase the level of dopamine. Because of dopamine you are getting that kick, energy, and because of acetylcholine you are having good attention. Please write down. Acetylcholine, good attention, good concentration, good judgment power, good mathematical calculation. It means cigarette is good. Correct that person? So basically what I am saying is that acetylcholine is responsible for what? Attention, concentration. You can say that acetylcholine is what? Attention hormone. Easy to understand? Attention hormone याद रहेगा? Attention hormone. इतने पे बोल के नहीं रुक जाऊंगा. क्या हुआ? तो मैं क्लास ले रहा था ISM किर्गिस्तान. So I said it is good. Okay, ये तो बोल के ह्यूमर था. Sarcasm है, right? During interval, one student came. He asked me, sir, because of you, I started cigarette again, sir. Right? So suppose if you are using cigarette for a longer time after that, GI cancer, urogenital cancer, lung cancer, multiple cancers. 50% of the world cancer is because of tobacco. 50%. So it means cigarette is bad. याद रहेगा. Fine. Related to acetylcholine, please write one more point. It enables muscle action. It enables muscle action. It enables muscle action. So if there will be decreased level of acetylcholine in your body, obviously now you will be what? After that you will be lethargic, right? So your muscles will be weak. So I can say that in Alzheimer's disease also there will be degeneration of neurons producing acetylcholine. Easy to understand? Fine. That's why we are giving that kind of drug related to acetylcholine earlier. Easy to understand, no? Fine. Norepinephrine, please write down. Norepinephrine, this is responsible for alertness and arousal. Alertness and arousal. Alertness and arousal. Norepinephrine is responsible for alertness and arousal. Means if there will be deficiency of norepinephrine in your body, like in your, whenever there will be deficiency of norepinephrine, after that, no arousal, no alert, basically to myself, basically depression also. Same like depression. So when I have given SSRI, for the depression, okay, I have increased the level of serotonin, but still patient has the same symptom. Now I'm going to try one more drug, that will be SNRI. So now with the help of SNRI, like venlafaxine, I'm increasing the level of serotonin also, norepinephrine also. Easy to understand? Fine. So first line of treatment for depression is always SSRI. If that is not being used, okay, and after that we can try SNRI. Easy to understand? Now without saying the notes, tell me, awareness about disease is called as what? Enzyme will be present in neurosis. Some changes, especially in the elderly age, on radiological investigation. Organic or not? Organic. Hormone of kick. Attention, neurotransmitter. Alertness, arousal. Happy hormone. बस ये साइकिल ठीक है चलो now we are going to learn these chapters. See here, first chapter basics. First chapter I am telling you, every time minimum 2 questions are there. 2 questions. Basically in the general psychiatry we are going to learn each and all ABCD about psychiatry. This time 2 questions. Every time 1 or 2 questions from here. Because here, like here only we are going to learn about delusion, hallucination, all mental status examination and all. Okay. Second, schizophrenia. Always remember that. Schizophrenia is this much important disease that without making a question from schizophrenia, you can say this will be the insult of examiner. Means without schizophrenia there cannot be a question paper. Okay. Okay? In any patient, if there are more than 2, 3, 4, 5, 10, 20 symptoms, 100% patient is suffering from schizophrenia. Remember here, if more than 2 symptoms are there, 100% schizophrenia. Suppose if there is a very, very big question, if you don't know the exact answer. Option is schizophrenia, not this will be correct. It's important. Seriously, it's important schizophrenia. Find out? So basically I can say that schizophrenia is what? House of diseases. House of psychotic symptoms. House of psychotic symptoms. After that, mood disorder. Here we are going to learn about emotion, depression. Only depression है unipolar. Depression के साथ में अगर mania आ गया तो okay. Every time one question from here. ये देख के क्या लग रहा है भाई? ये देख के लग रहा है क्या ये मॉडलिंग करना है? Wearing the dress of opposite sex, if a person is getting sexual gratification, oh my God, there is some problem. Sexual disorder. Do you think like circus कर रहा है? Hurting your partner and you are getting erection and orgasm. You are sadist. Question? है ना? Basically क्या 50 shades of grey. नहीं है sadism, right? है ना? So इसमें क्या है? Hurting your partner. जिसका बेड पर जो भी यूज करना है जैसे वाटर बेसिकली सेक्सुअल डिसऑर्डर एवरी टाइम वन क्वेश्चन मैंडेटरी दिस टाइम INI-CT NEET PT so only this time they have not asked sexual question like in the MCI but every time if you see 5 years old paper no in every examination there will be one question from sexual disorder paraphilia which I will teach you in detail ठीक है sleeping disorder 1 month before exam, mandatory. You are going to bed at 9 p.m. but sleeping at 1 a.m. It is called insomnia. Insomnia, right? Insomnia, sleeping disorder. Yes, sleepwalk. You know the term we are using for this? Somnambulism. Somnambulism means what? Sleepwalk. इसका psychiatrist का क्या काम है? Basically, remember here, somnambulism, this is a disorder of deep sleep, very, very deep sleep, where a person does not remember anything, unconscious. Huh? How would I understand? So during somnambulism, a person can commit any, like any kind of, like murder also, any kind of crime. Right? Now there will be need of psychiatrist. After that, you have to do what? Sleep study. Sleep study. I have to admit the patient in hospital for observation. Question is that we have to check whether he is a real patient or he is faking their symptoms and entering the hospital. हो सकता है बिल्कुल, right ना? So basically we are going to learn here on sleep factor study, right ना? Polysomnography and all. Neurotic stress related, basically anxiety, OCD, PTSD, hypochondriasis, everything will be learning here. OCD ये क्या है? देखो fourth जो last to last time MCI. This was the image given. Which disease patient is suffering from? OCD of contamination. देखो इस तरह के question आते हैं, right? See, when I will teach you personality disorders, no. After that, everyone will be having this kind of that you are suffering from at least one. पक्का होगा सबको, ठीक है? But every time one question mandatory है. One question personality disorder mandatory. See, देखो, in every batch there will be a child who will always be disturbing other kids. In every batch, who is always roaming in the class, right? Who is always disturbing the other people, right? Suppose if the teacher is asking a question from anyone, he will not be able to wait for his turn. Yes sir, yes sir, yes sir. ADHD, attention deficit hyperactivity, right now? Okay, fine. Autism, mental retardation, all these we are going to learn in child psychiatry. Child psychiatry, very, very important. This will be more common among male or female. Obviously, eating disorder among female. How many disorders you know? Bulimia, anorexia, bulimia, anorexia. Okay, see, देखो eating disorder का क्या सीन है? Obviously, this will be more common among females, and especially young female, adolescent, because everyone would like to become like Deepika Padukone, Angelina Jolie. Basically, figure conscious. But after eating disorder, she will become malnourished Deepika. ऐसे होता है, बहुत ही common. देखो, young age में this is very much common, very, very common, right? Image conscious, but every time see one question, or in every alternate exam one question from eating disorder. This time no question from eating disorder, but last to last time in AIMS also, MCI also, NEET PG also, one question from bulimia and anorexia. This is for boys. First of all, I will teach you how to. Substance abuse, extremely common. And for exam also, every time minimum 2 questions in MCI exam. MCI, this time in November there was INI-CT exam. How many questions from psychiatry they asked? 13 questions there from psychiatry. 13. 6 questions were related to psychopharma. Means psychiatry disorder plus pharmacology. How to treat the patient, side effect of the drug and all. So 6, but 7 questions direct from psychiatry. Okay, 6 questions were related to psychopharma. 3 questions from alcoholism. How to de-addict a patient. Okay, so which medicine we are going to use there. Right now? So basically substance abuse, I am telling you, minimum 2 questions you are going to get every time. Okay, 1 or 2 to pakka hai, 100%. So kya hoga? First of all, I will teach you how to abuse the substance. From which shop you can buy which? Sasta nasha, mahanga nasha. After that, how to get yourself de-addicted. After that, how to come to me, right? ठीक है, de-addiction center पे. I was taking a Zoom session. Zoom session में तो पता नहीं होता ना, स्टूडेंट के साथ में पेरेंट्स के बैठे होते हैं. पता नहीं होता ना. तो मैं पढ़ा रहा था, बड़े दोस्त में पढ़ा रहा था. सब्सटेंस अब्यूज, चलो ठीक है, पढ़ते हैं हम, है ना. तो मैंने पढ़ा, देखो बेटा, अल्कोहलिज्म एंड ऑल. ओके, भांग गाने सब नाम आ गया. There was a student, female student. She asked her which one is most potent drug. Starting क्या मैं बोले बेटा रुक जा. सब पढ़ा हुआ, सस्ता नशा, महंगा नशा, सबसे महंगा कहाँ पे दुकान भी बता दूंगा तेरे को. After that, she texted in Zoom. Texted, sir, you embarrassed me. How? Well, sir, my mother was sitting here, and after that, she asked, what kind of Bhajan teacher you have? Embarrassing situation. And whenever I'm sure you are sitting, to cover karna padega. I'm sure you are sitting with your parents also, but please understand, we are learning psychiatry. Before seeing the patient, look for substances. पहले समझो कि भाई ये तंबाकू क्या होता है. बोलो सुबह कैसे. First of all, understand the substances. After that, we can understand the patient, right? And I think everything is clear now. Let's move on. So basically, here we are going to learn about alcoholism, cannabis, bhang, ganja, cocaine, heroin, opioid, right? After that, cigarette, tobacco, amphetamines, modafinil, benzodiazepine, everything. Yeah, ये फोटो देखिए बताओ क्या होता है. All these are what? See here, all these are the modalities of treatment. क्या दिख रहा है ये? इसमें शॉक लगा रहे हैं आपने. क्या है ECT. ECT का फुल फॉर्म क्या होता है? Electroconvulsive therapy. ECT means what? Electroconvulsive therapy. Very easy to understand. Okay, fine. देखिए होता है क्या था ना. देखो here I am giving electric shock. I am giving electric shock. So many side effects. And I have to give anesthesia also. So many side effects. So that's why now we have new modality of treatment. This is what is the name of these two here? This is called a TMS. TMS which I will teach you in detail. See, देखो अभी पहले मैं सिर्फ orientation दे रहा हूँ psychiatry का. What we are going to learn. ठीक है ना? TMS is what? Transcranial magnetic stimulation. Here no anesthesia. We are using magnetic field only. ये क्या दिख रहा है? Basically psychotherapy. Talk therapy. जो आसान भाषा में बोले तो counseling. That's it. Okay, no? So all these modalities of treatment we are going to learn. After that, psychoanalysis. Here we are going to learn about ego, superego, defense mechanism, right? Or defense mechanism. Suppose if a young boy who is having sexual feeling for his mother, young daughter, 4-year-old daughter, she is having sexual feeling for her father. Everything we are going to learn in psychoanalysis. After that, organic mental disorder like delirium and dementia, right? So let's start first chapter. I hope all of you have the notes. Fine. So let's start with the basics. See here. Overall, this is called a what? See here. Study of mind or the soul is psychiatry. See, there is no single father of psychiatry. So no problem at all. I know. So you have to remember all fathers. See, they are going to ask you father of American psychiatry. American, especially in John English. But overall, across the world, find a father of modern psychiatry is Emil Kripke. Why is called as the father of modern psychiatry? Please write down, because he was the first doctor, he was the first psychiatrist who spoke about schizophrenia. Emil Kripke, father of modern psychiatry. Who coined the term psychiatry? It was coined by John Christian Ryle. See, Ryle लिखा हुआ है, लेकिन जो उनके कंट्री में प्रोनाउंसिएशन था Ryle. John Christian Ryle, he coined the term psychiatry. अब देखो Sigmund Freud, remember here, Sigmund Freud is like Shah Rukh Khan of psychiatry or Rajnikant you can say. Sigmund Freud, he was one of the most revolutionary persons on the earth. Revolutionary, जो लोगों का सोचने का तरीका बदल दिया पूरा. Father of psychoanalysis. See, remember here, don't get confused. He is not considered the father of psychiatry. Father of psychoanalysis. Okay, fine. He was the first doctor who introduced cocaine in medical world. Sigmund Freud introduced cocaine in medical world. Up to 1903, cocaine was added in Coca-Cola also. After that, they got to know, oh my God, there was severe addiction, and this was the narcotic drug, so they removed it. Fine, no? So sometimes, even if you do not remember father of psychoanalysis, yaad rakhna, father of cocaine. Sigmund Freud, because see, actually, cocaine we are also using as local anesthesia also. The drug abuse, obviously, a lot. See, like, it was said that Sigmund Freud got addicted to cocaine and he died because of cocaine. Okay? Fine. So now, without seeing the notes, can you tell me who coined the term psychiatry? John Christian Ryle. Father of American psychiatry? Father of modern psychiatry overall? Emil Kripke. Okay, fine. Father of psychoanalysis? Awareness about disease is called as? Reward, pleasure, addiction, because of which neurotransmitter? Dopamine. Alertness and arousal? attention concentration, happy hormones. Now, how to assess a psychiatric patient? How you are going to do the examination? You know, suppose if you have a patient, 19-year-old female patient, she is wearing jeans and a top. Okay, she is wearing jeans and a top. Now she is in your department and she is saying that, doctor, for last 1 month, I don't feel good. I am having negative thoughts also. Lack of sleep. Depression, you are suspecting depression. How you are going to assess her? How you are going to examine her? Basically, how you are going to examine her? Batao. History taking. So, most important thing in the examination of any psychiatric patient is what? History taking. History taking. See, like if you want to become a psychiatrist, you know, कितने लोग बनना चाहते हो psychiatrist यहाँ पे? How many of you would like to be? 1, 2, 3. Most of the people don't want to become psychiatrists. आपको क्या लगता है psychiatrist करके नहीं करना चाहिए? Psychiatrist, if you become a physician or whatever, a physician, surgeon, you will get a patient for 1 or 2 times. At least for 10 times. At least for 10 times, and psychiatric, all medications are very, very expensive. Apart from that, if you do psychotherapy and all, so much. Okay? Okay, fine. See, I think after completion of the subject, I think number will increase. See, देखो क्या होता है इंडिया में क्या होता है ना साइकियाट्रिस्ट बनना एक वो सोशल स्टिग्मा है ना लाइक इफ यू वांट टू प्रैक्टिस एज अ साइकियाट्रिस्ट इन द विलेज नो वन विल कम टू यू सोशल स्टिग्मा साइकियाट्रिस्ट के आपको समझते हैं कि डॉक्टर ही पागल है साइकियाट्रिस्ट अगर भागेगा वो भागेगा वो सी ऐसा ही है इंडिया में तो अरे अगर किसी को देख लिया साइकियाट्रिक क्लिनिक से निकल तो कहाँ गया था वो पता नहीं कौन सा क्राइम करके निकल गया लोग छुपाते भी है मैं कसम से मैं घर पे कभी नहीं बोलता हूँ कि मैं साइकियाट्रिस्ट से मेरे को वास्ता भी है आपने ठीक ठाक डॉक्टर है बस ओपीडी देख लेते बस क्योंकि सोशल स्टिग्मा है आपने ढीले जिंदगी देखा था इसमें शाहरुख खान बोलता है अपने मदर को बोलता है गायनेकोलॉजिस्ट ऐसे है राइट हाँ बट इफ यू वांट टू प्रैक्टिस एज अ साइकियाट्रिस्ट लाइक यू हैव टू सिटी में बहुत अच्छा काम है सिटी में योर पेशेंट्स आर वेल अवेयर आएंगे आपके पास में है ना गांव में आएंगे पेशेंट नहीं आएंगे आपके पास में ठीक है ये जीन्स एंड टॉप जो है मैंने मेंशन किया 19-year-old female she was wearing jeans and top do you think mentioning jeans and top was necessary लग रहा है कि necessary मेंशन करना चाहिए था कि नहीं करना चाहिए No need to mention. External appearance is very, very important. External appearance is very, very important. Please understand here that after that you can understand that she is suffering from a higher socio-economic status disease or lower socio-economic. Easy to understand? And a patient को देख के गेट पे एंट्री वाला समझ जाओ कौन सा पेशेंट आ रहा है तुम्हारे पास देखिए कम से कम अंदाजा जैसे सर्जरी डिपार्टमेंट if you are in the surgery department especially in the neurosurgery department night time 2 o'clock male patient, a young patient, suddenly he entered there, like in the emergency department, sir, what is the diagnosis? Okay. Okay, diagnosis कौन बोलो आप? सही जा रहा है दिमाग से जा रहा है एडवाइस कर रहे हो क्या बोलो? रात में कुछ तो होगा कनेक्शन होगा मेल का रात में ज़्यादा सोचेगा यंग पेशेंट में क्या होगा यंग स्पेशली इन द मिडनाइट में उसको बैक पेन स्टार्ट हो मोस्टली क्यों रीनल स्टोन है ऐसे देखो जैसे बेसिकली पेशेंट को देख के आइडिया होना चाहिए है ना पेशेंट को देख के आइडिया होना चाहिए कि रात में स्पेशली क्योंकि वहाँ पे देखो जहाँ पे ड्यूरेशन में कहीं पे भी है ना तो बिकॉज ऑफ दी व्हेनेवर ब्लैडर विल बी फुल after that there will be pressure over the stone and the stone is going to irritate the wall after that patient will be having what severe response patient will be having severe pain patient को देख के समझ जाना राइट ना ओके मैम तो थोड़ा एक बेसिक अंदाजा हो गया ऐसे एक पेशेंट आ गया ओपीडी में पेशेंट ऐसे करके आ रहा था पेशेंट ऐसा ओके सो लाइक इन दी ओपीडी one neurosurgeon was sitting, orthopedician was sitting. So they say, ortho वाला बोला कि मेरा केस है, न्यूरो वाला बोला कि मेरा केस है. ठीक है, आपस में डिस्कस कर रहे थे, हल कर रहे हैं ना, तो पेशेंट आया ऐसे करते करते डॉक्टर पूछा है क्या हुआ, और तो कभी कभी होता है. फाइनल ओके चलो ठीक है. तो मोस्ट इंपॉर्टेंट क्या हिस्ट्री टेकिंग. देखो साइकियाट्रिस्ट को कभी कभी क्या जैसे रिमेंबर यार, मोस्ट ऑफ द साइकियाट्रिक पेशेंट्स दे डोंट वांट टू सी द डॉक्टर एंड दे विल नॉट बी विलिंग टू टेक एनी काइंड ऑफ ट्रीटमेंट. तो अगर आप उसको लेकर के जाना डॉक्टर के पास है ना, तो कभी कभी होता है बहला के, फुसला के, झूठ बोल करके. Right, so basically you have to manipulate the patient. So there was a patient जो मेरे एक सीनियर का केस था, एक जोड़ी था हमारे, उनका केस क्या था कि ये पेशेंट नहीं आ रहा था. तो पेशेंट को समझ, पेशेंट को बोला उसके फैमिली वाले ने कि हम लोग चलते हैं शॉपिंग करने. तो शॉपिंग के नाम पे ला करके क्लिनिक के सामने रोक दिया गया. क्लिनिक के सामने आफ्टर द पेशेंट वाज नॉट गेटिंग अप. तो फैमिली मेंबर्स ने कहा कि इसका पेशेंट तो नहीं आ रहा बाहर. तो हमारे एचओडी आ गए, पेशेंट के पास आके ऐसे देखा करते आफ्टर दैट ये था पेशेंट भागा मारने बट ट्रीटमेंट यही है भाई, ऐसे ही होता है ट्रीटमेंट. मोस्ट ऑफ द साइकियाट्रिक पेशेंट्स विल नॉट बी, दे डोंट वांट टू टेक एनी काइंड ऑफ ट्रीटमेंट. तो डॉक्टर से नफरत होती नहीं आएगा, तो बहला के, फुसला के, झूठ बोल करके लाना पड़ता. फर्स्ट ऑफ ऑल क्या करोगे, history taking, right? History taking. First of all, history taking. After that, clinical examination. So my question is that 19-year-old female, what kind of questions we are going to ask? History taking तो लेना पड़ेगा ना. History में क्या क्या पूछोगे क्वेश्चन तो? Abuse पूछोगे, history of abuse. Okay, और relationship is very important. 19-year-old female, yes. Academic variance. Field work है, ठीक है. Family background, drug abuse also या 90 adventures हो सकते हैं. Adventures, right? और अच्छा क्वेश्चन पूछो, कितनी बड़ी होगी तुम छोटी बच्ची हो क्या? यार एडल्ट हो गया, आगे बात करो, बड़ों वाली बात करो. बेसिकली व्हाटएवर क्वेश्चंस यू आर thinking, everything is right, but most important question you forgot related to menses problem. Menses. Menses is 7 days before menses there will be fluctuation of mood for sure. And see, always remember that good doctor takes good history. ठीक है, मैक्सिमम हिस्ट्री अगर आपने ले लिया ना, आफ्टर दैट यू विल बी हैविंग सो मच ओरिएंटेशन अबाउट द डायग्नोसिस. आपका अंदाजा वहीं पे हो जाए. ठीक है ना. सो बट एवरी टाइम यू हैव टू आस्क द मोस्ट रिलेवेंट क्वेश्चन. सपोज सेम क्वेश्चन, सेम सिनेरियो, फीमेल पेशेंट इज देयर विद abdominal pain, with abdominal pain. What is the first question you are going to ask? LFP, last menstrual period. Same acute abdominal pain like a boy is there. लास्ट में पार्टी कहाँ किया था, कहाँ की बिरयानी खाया था बेसिकली, राइट? बेसिकली as per the patient you have to ask only the relevant questions, right? Because in this manner they are going to frame the question that which of the following is not a component of history taking, right? So let's understand what kind of questions we are going to ask to the patient, right? History taking very very important. See here, same thing. First of all, I am going to ask about here what menses and obstetric history. I am also asking about the perinatal history. Why perinatal history is important? This is my question. Means I am going to ask her, where was the delivery happening in your case, like at home or at hospital? This is important to know. Because remember here that in India, 64% people still they are living in villages, and most of their deliveries are being performed by dais. Dai lo karti ho na dai. So always remember that obstetric complication is a higher risk factor for the development of schizophrenia. When I write SZ means schizophrenia. ठीक है ना? So remember, obstetric complication, that is a risk factor for schizophrenia and mental. Easy to understand? So that's why it is very, very important to ask. And sexual history, obviously, yes. Now, I will be asking, when did you achieve the puberty? Okay. Now, what is the importance of this question? What kind of child you were? My question is that, like first of all, like any kind of abuse, But I am also asking about the play history. See here, when you were a child, you were allowed to play with other kids, and you were being discriminated by other kids. Discriminated by other kids. Fear of rejection, feeling of rejection, depression in the future. Easy to understand? Okay, so all these questions are very, very important. See, related to substance abuse, obviously yes. And so overall, basically all these questions are mandatory. After that, physical examination. And this question was asked in AIMS. Please solve this question. AIMS का question देखो कितना easy दिख रहा है, कितना बहुत. Obviously, veg or non-veg, no relation with depression. आपकी मर्जी, right? So this is what? Food differences, right? After see here, whenever you are going to take the history, it takes reliability and adequacy. Reliability means, see, as per India, what is happening there, most of the time, patient will not be coming to you alone. Patient will always be accompanied by someone, either a family member or either a friend, roommate, anyone. Sometimes patient is speaking a lot. What is your diagnosis? The patient is not speaking at all. So, like in both cases, you need a reliable informant who can speak normally on the behalf of patient. So, like one is patient, A is patient, and B is the informant, his friend or family member. Right? So, first of all, we have to check whether the information which we are getting, those informations are reliable or not. The person who is speaking, he is reliable or not, and information is adequate or not. CBE, understand here? First of all, there should be consistency. In every cycle, a story should be same. Cycle means what in psychiatry? I'm asking my patient that you have to go through 6 cycles. So every week you have to come for the consultation. Fine? So like one cycle, 2 cycle, 3 cycle. I know. Every time a story should be same. Story should be same. It should be logical, and it should be in what? Continuous manner. Step 1, 2, 3, 4. After that, I want to check. See, after that, I want to check the informant. The person who is speaking for patient. See, what I want to check here, this is your question. First of all, I want to check how much he is actually close with that patient. How much actually he is concerned for the patient. Duration of the stay with the patient. Suppose if I have been living with my roommate for last 6 months, and my brother who is in the USA, okay, fine, and I am suffering from a mental illness, fine. Now you tell me, who will be a better informant here, my roommate or my brother? Because with my brother, I used to meet once in 2 years or 3 years, so my roommate will be better, right? So my roommate will be better informant. Here there will be no relation of the biological relation part, okay, fine. Educated informant, obviously he will be having better, he will be having better observational skills, right? Now suppose if both roommates are actually medical, obviously he can explain it better. So can you solve this question? Next question. Next question. And see here, like in this question, answer will be D. But remember here, at some platforms they have given different answer. But this is as per the new research which I have added here. Now 6 point is all. Okay, this is also added. Okay, now and duration of the stay and educational level of the observant. Right? Very, very important. Having said that, in this same question, if examiner is mentioning mother and her baby are there, then at that time biological relation will be most important. Right? We cannot rule out that. Easy to understand? So you have to see the situation of the patient, situation of the question, then you have to mark the answer. Now, second step is called the clinical examination. So can you solve this question? Dekho? ABCD, what is your answer? C कह रहा हो, C, D कह रहा हो. See, remember here, always remember that across psychiatry, when we have to do clinical examination of a psychiatric patient, this is always mental status examination. mental status examination. Mental status examination. But what about this one MMSE, which is mini mental status examination? Mini hai, mini means what? Micro examination of the mental status. Micro. So why MMSE is not? Always remember that across psychiatry in all diseases. In all diseases, clinical examination of the patient is done by MSE, mental status examination. Mental status examination. But when I talk about organic mental disorder, at that time, first examination to be performed is what? MMSE. Yaad rahega? MMSE. Fine? Now when I talk about if I have to compare organic mental disorder and non-organic mental disorder, which one will be seen mostly among elderly age? Which type of hallucination will be most commonly seen in organic? Visual. What about non-organic? Here, altered sensorium can be seen in. Very easy to understand. So remember here that overall, what the name of clinical examination in a psychiatric patient? Mental status examination. But especially in organic mental disorder, mini mental status examination. Right? So we are going to learn all these. See here. First of all, general appearance. After that, rate and tone of speech. See what is happening here. Suppose the patient is speaking a lot. What is your diagnosis? Mania. Patient is not speaking at all. Depression. Right? Mood and affect. Always remember that mood and affect, they describe what? Emotion. Mood and affect, they describe emotion. Mood and affect both are same thing. They describe emotion. Right? No, emotion. So what I am saying is, suppose if a person is very, very sad, emotional problem, depression is a disorder of emotion. Easy to understand? So depression and mania, easy to understand? Okay. Perception means what? How do we perceive? How many senses do we have? 5. Visual, audio, olfactory, gustatory. Taste is called a gustatory. And what was this one? Touch means tactile. Okay, suppose there is no buffalo. Suppose if there is no buffalo in operation theatre, if a doctor can see what the buffalo is doing here, visual hallucination. Why this buffalo is singing a song for me? Auditive hallucination. After using the public toilet, especially the railway station, ammonia. And if a person says, "Wow, what a smell here, man!" Right? After having gulab jamun, salty, bitter. Respiratory hallucination. Cocaine abuser. Suddenly you are, oh my God, under my skin, bugs under my skin. What does it mean? Easy to understand. So I can say that hallucination is a disorder of. And what is the disorder of the thought? Delusion. Delusion is a disorder of thought. After that, we are going to learn about higher mental function with the help of cognition. ये नाम तो सुना होगा cognition कहीं पे? Remember here, cognition is a broader term. Cognition is a mental process with the help of which we are learning. Something, right? Like writing, speech, memory. Easy to understand, no? And action. Okay, all these are actually called action, speech, memory, emotion. And so all these are actually what? All these are called cognition. Correct? So remember, cognition is a mental process with the help of which we are learning like memory, speech, mathematical calculation, action. How to behave in a marriage ceremony, we have to. So basically, this is all about the cognition. How to greet any stranger, how to greet any elder. And easy to understand? I have a patient after headache or after schizophrenia. Patient does not know how to behave in the social gathering. He forgot how to button his shirt. See, after a head injury, do you think a person can have loss of memory? Yes. So do you think he can have loss of action? Obviously, yes. Do you think he can have the loss of the mathematical calculation also? Yes. Now I'm going to teach him with the help of behavior therapy. Okay, see, in this manner we are going to button the shirt, right? In this manner we are going to comb the hair, and in this manner we are going to wear the wristwatch. See, in this manner we have to greet and be stranger. Basically, what I am doing here, a behavior therapy to improve the cognition. It is called a CBT. CBT याद रहेगा? This is called as cognitive behavior therapy. Most important therapy in psychiatry. Cognitive behavior therapy. Same question I asked in Chennai. What is the full form of CBT? The student replied, "It's a computer-based test." Right? Computer-based test. Psychiatry है. तो CBT का full form क्या बोला था? Cognitive behavior therapy. ECT का full form क्या था? ECT. Who coined the term psychiatry? John Christian, father of psychoanalysis, father of modern psychiatry. Emil Crippen, who introduced cocaine in medical world. Very easy to understand. So now you understand the meaning of CBT. After that, insight means what? Awareness about this is judgment power. So all these are what? Mental status examination, which we are going to learn one by one. From here, one question. This kind of question they ask in DNP, simply to boost your morale. DNP PG. Sometimes intentionally examiners frame these kind of questions so that we should have kind of कि हाँ मुझे कुछ आता है फिर अच्छे से लिखो एग्जाम mood and affect. Now, how to differentiate mood and affect? See, what I have taught you just now, mood and affect both are the same thing. Mood and affect means emotion only, but how to differentiate? Please understand that. Please understand here that mood is what? Long-standing emotion. Please understand? Long-standing emotion. What does it mean? Suppose if a patient is there, okay, doctor, you know one thing. For last 1 month I was really, really sad, but now when I see you, for last 1 month, long-standing emotion, now I'm smiling. Affect is short-term emotion. Short-term emotion, externally visible emotion. Externally visible emotion. Externally visible emotion, that is called as affect. And mood is what? Long and internal emotion. Long-standing internal emotion. How do you understand it more clearly? You have a patient of diabetes, obviously you are going to, right? You have a patient of diabetes mellitus. You are going to check 2 tests, HbA1c and a random blood sugar also on the spot. HbA1c will give you sugar level for last 25 to 90 days.